LiberalViewer presents.
So, welcome to this LiberalViewer special media bias clip roundup. Thanks for joining me. This is kind of like one of my old school Fox News bias videos, and I've made hundreds of those. I put links down in the video description to my Fox News bias playlist, my Fox News bias in video editing playlist, and in my opinion, this video belongs in their company. I'm just didn't have time for various reasons to make an edited, produced video today, so I guess in the words of the immortal Bill O'Reilly, fuck it, I'm doing it live. Which means this is unscripted, sometimes a little bit rambly, as my Sunday live clip roundup viewers know, but I saw coverage this morning. I happen to have the privilege of being able to record all the big five corporate outlets, and that's why I do my Sunday live clip roundups, and the ability to capture good quality clips. And so I watched at 6 a.m. here on in California time, both MSNBC and Fox News. It's MSNBC Live with Stephanie Ruhle and America's Newsroom with Bill Hemmer and Dana Perino. And at around 6:15 a.m., I think it's like 6:13 a.m., they both covered the exact same story. The fight yesterday between Senator Rand Paul and Dr. Anthony Fauci about whether you still have to be masked after you have been vaccinated or have been infected by the coronavirus. And as you might imagine, the coverage was vastly different. Both the coverage and even the way they edited the clips of Rand Paul and Anthony Fauci. So I'm going to present all of that to you. And like in my old school videos, I YouTube, you decide. You get to decide. I think it's Fox News bias, but I'm going to show it all to you, and then I'm going to show you the entire almost 8-minute interchange between Dr. Anthony Fauci and Senator Rand Paul at the end, so you'll have all the facts and you can decide if I'm right or not. I'll even ask you some of my traditional liberal viewer questions at the end before I let you decide. So, like I said, thanks for joining me for this live stream, and I'm going to start with, this is a little over 2 minutes from America's Newsroom on Fox News this morning, talking about Anthony Fauci and Senator Rand Paul fighting yesterday about masks, and then they have on their medical expert, Dr. Mark Siegel, and see how he bolsters Rand Paul's side, and notice the video editing in this clip.
We just asked that question about COVID. This came up yesterday on the Hill as well. Watch the exchange.
What studies do you have that people that have had the vaccine or have had the infection are spreading the infection? If we're not spreading the infection, isn't it just theater?
No, it's
not.
not.
The vaccine and you're wearing 2 masks. Isn't that theater?
Let me just state for the record that masks are not theater.
You've been vaccinated and you parade around in 2 masks for show. You're defying everything we know about immunity by telling people to wear masks who've been vaccinated.
No.
You want to get rid of vaccine hesitancy? Tell them they can quit wearing their mask after they get the vaccine.
So it was a heated exchange at a COVID hearing when Senator Rand Paul challenged Dr. Anthony Fauci on why Americans should keep wearing masks even after being vaccinated. Let's bring in Fox News medical contributor Dr. Mark Siegel. Dr. Fauci said that it's not theater. What do you say?
I think it's right in between, as usual. I think it's a very interesting debate. I think Dr. Rand Paul has worked in emergency rooms. He's a prominent ophthalmological surgeon. He's worthy of his position. I think his point is, Dana, if you get vaccinated, more and more studies and data out of Israel show that your risks of spreading this are extremely low. Much less virus in your nose, much less ability to transmit. And we have to make an accommodation to that to tell people you're getting something for your vaccine. It's allowing you freedom. Your psychological binds are being removed. That's so important. the mask itself is a symbol, and I continue to wear it even though I've been vaccinated, as a psychological acknowledgement that I'm part of a community of people, the United States, trying to prevent spread. I want to do that. I don't consider it theater, but on the other hand, Dr. Paul is right. The chances of you spreading it after you're vaccinated, extremely low, and we need to get that message
I tell you,
out.
I've watched that clip a lot, and just in the last day. What he's saying is you've been vaccinated and you're still wearing a double mask, right? I mean, just to put it in English, if you want to tell people to get a vaccine, this is the way you encourage them to get a vaccine, by not having a double mask after you've been vaccinated. I mean, it's a contradiction for all those who have signed up to get the vaccine. That's the way I hear it. Another question here. 3 feet or 6 feet in the classroom?
Exactly right.
Oh, and then Dr. Siegel says you're right. And Dr. Siegel is often used as a medical expert to also be a proponent of right-wing views. And, of course, if you read, you can barely see it, The Loudest Voice in the Room, I have it like partly cut off over here, is a book that shows you how Fox News is actually created by Roger Ailes as a propaganda outlet. I think Dr. Mark Siegel was hired because he was Roger Ailes' doctor. Was he Bill O'Reilly? Someone big on Fox News. He was their doctor, and that's how he ended up being a medical expert. I can't remember who it was, but I think it's in The Loudest Voice in the Room. Maybe when one of the clips is playing, I'll like grab it off the shelf and look in the index and find out for you. But like I said before I showed the clip, Mark Siegel definitely bolstered Dr. Rand Paul, and how he definitely deserves his position, and is a great ophthalmologic surgeon who's been in emergency rooms. You saw all that there. So, and you saw the way they edited the clip to make it look like Rand Paul won that argument between Rand Paul and Anthony Fauci. So compare that to the MSNBC clip that's a little under 2 minutes. Like I said, ran at almost exactly the same time as the clip you just watched, but vastly different spin. And I think the way they edited the Rand Paul, Anthony Fauci argument is, to coin a phrase, more fair and balanced. But you can let me know what you think after you watch that MSNBC clip over here.
Well, then let's talk about what you can do once you're vaccinated as far as it relates to wearing a mask. Because I want to share what Rand Paul said yesterday, calling Dr. Anthony Fauci vaccine theater as far as mask wearing. Watch this.
No, it's
You had
not.
the vaccine and you're wearing 2 masks. Isn't that theater?
No, that's not. Here we go again with the theater. Let's get down to the facts. When you talk about reinfection and you don't keep in the concept of variants, that's an entirely different ballgame. That's a good reason for a mask. Let me just state for the record that masks are not theater. Masks are protective. And we
You have
ask
immunity there, theater. If you already have immunity, you're wearing a mask to give comfort to others.
Senator
You're
Paul,
not
you're
wearing a
out of time,
mask
and I
because
would
of any
like Dr.
sign.
Fauci
I totally disagree with you.
What's your reaction to that?
Well, you know, it supports what more and more research is showing, and that's that people really want to get their medical information, their medical advice from trusted health leaders and not politicians. There was some wonderful data over the weekend with a conservative group where people were very vaccine hesitant. Hearing information from trusted health leaders led many people to change what they were thinking. It may be in time that the data say once you're fully vaccinated, you don't need to wear masks. But there's a lot of concern right now about the variants that are out there. How much protection do you truly get from vaccines? Can you transmit those to other people? And I like to get my advice from the world's leading health experts on that. And hopefully at some point, and I know that point will come, we are going to be told what we can loosen up on.
So vastly different spin there. And when Dr. Richard Besser there, who was he acting head of the CDC? Correct me in the comments if I screwed that up. He was acting head of something, they said, and I should have looked it up beforehand. But like I said, I had to do things live because I'm kind of pressed for time today. But I wanted to make this video and compare what you just saw on MSNBC. I think Dr. Richard Besser, when he was talking about listen to authorities and world-renowned experts, that I think he's talking about Dr. Anthony Fauci and not Dr. Senator Rand Paul. But I also thought that the editing of the argument between Senator Rand Paul and Dr. Anthony Fauci was more balanced in terms of giving them equal time. Over on Fox News, it was like almost all Rand Paul. Before I show you the full interchange between Rand Paul and Anthony Fauci, I want to just show you the video editing. Like I said earlier, at a link down in the video description, you can find my Fox News bias in video editing playlist, which is a subset of my Fox News bias playlist, which is also at a link down in the video description. Hundreds of examples of Fox News bias, but I really think the video editing makes this video I'm making now a fair addition to the Fox News bias in video editing playlist. And so to make that point, I'm going to compare just the way they edited together the argument between Rand Paul and Anthony Fauci. First, here is, they're both a little over 30 seconds. Here's the Fox News version first.
What studies do you have that people that have had the vaccine or have had the infection are spreading the infection? If we're not spreading the infection, isn't it just theater?
No, it's
not.
not.
The vaccine and you're wearing 2 masks. Isn't that theater?
Let me just state for the record that masks are not theater.
You've been vaccinated and you parade around in 2 masks for show. You're defying everything we know about immunity by telling people to wear masks who've been vaccinated.
No.
You want to get rid of vaccine hesitancy? Tell them they can quit wearing their mask after they get the vaccine.
So yeah, I think that definitely made it look like Rand Paul won the argument. More, like I said, to coin a phrase, fair and balanced, I think, is the MSNBC editing of their argument, which is a little bit longer, like 37 seconds over here.
No, it's
Had
not.
the vaccine and you're wearing 2 masks. Isn't that theater?
No, that's not. Here we go again with the theater. Let's get down to the facts. When you talk about reinfection and you don't keep in the concept of variants, that's an entirely different ballgame. That's a good reason for a mask. Let me just state for the record that masks are not theater. Masks are protective. And we
You have
ask
immunity there, theater. If you already have immunity, you're wearing a mask to give comfort to others.
Senator
You're
Paul,
not
you're
wearing a
out of time,
mask
and I
because
would
of any
like Dr.
sign.
Fauci
I totally disagree with you.
Okay, so I've shown you the full coverage, Fox News versus MSNBC, and then I've shown you the video editing just of the argument between Senator Paul and Dr. Fauci. I've given you my opinion that it is Fox News bias. MSNBC, I mean, it definitely has a different spin, but I think it's much more accurate. It's a much more accurate portrayal of the actual interchange between Dr. Fauci and Senator Paul. And as part of my policy of giving you all the facts and letting you decide if my opinion is correct, as I said, like the I YouTube you decide from the old days, I am going to show you the nearly 8-minute interchange, starting with a long statement from Senator Rand Paul and then back and forth with Dr. Fauci, and then you'll see Senator Patty Murray, who's chairing the committee, lets Dr. Fauci give a clarifying statement at the end. And I think all throughout this clip, Dr. Fauci's winning. You can let me know what you think in the comment section after or as we watch it together over here.
Dr. Fauci, in a recent British study, David Wiley and others found that no symptomatic reinfections from COVID-19 after following 2,800 patients for several months. In fact, there have been no reports of significant numbers of reinfections after acquiring COVID-19 naturally. Shane Crotty, a virologist at La Jolla Institute for Immunology, concludes from his experiments that the amount of immune memory gained from natural infection would likely prevent the vast majority of people from getting hospitalized disease, severe disease for many years. In this study, which was published in Science, Dr. Crotty showed that antibody levels stayed relatively constant with only modest declines over 6 to 8 months. Dr. Crotty reported that, notably, memory B cells specific for the spike protein, or RBD, were detected in almost all COVID-19 cases with no apparent half-life at 5 to 8 months after infection. In other words, Dr. Crotty found significant evidence of long-term immunity after COVID infection. Furthermore, Dr. Crotty noted B-cell memory to some other infections has been observed for as long as 60-plus years after smallpox vaccination, or even 90 years after a natural infection with influenza. That was a woman who got the Spanish flu, still showed immunity 90 years later. So rather than being pessimistic towards people gaining immunity after they've had COVID or had a vaccine, studies argue for significant optimism. In fact, there have been no scientific studies arguing or proving that infection with COVID does not create immunity. There have been no studies showing significant numbers of reinfections. Of the 30 million Americans who have had COVID, only a handful of reinfections have been discovered. In fact, the New York Times reported last fall more than 38 million people at the time worldwide had been infected with the coronavirus, and as of that date, fewer than 5 of these cases had been confirmed by scientists to be reinfections. Scientists interviewed for the article concluded, in most cases, a second bout with the virus produced milder symptoms or none at all. Given that no scientific studies have shown significant numbers of reinfections of patients previously infected or previously vaccinated, what specific studies do you cite to argue that the public should be wearing masks well into 2022?
I'm not sure I understand the connection of what you're saying about masks and reinfection. We're talking about people who have never been infected before.
You're telling everybody to wear a mask, whether they've had an infection or a vaccine. What I'm saying is they have immunity, and everybody agrees they have immunity. What studies do you have that people that have had the vaccine or have had the infection are spreading the infection? If we're not spreading the infection, isn't it just theater?
No, it's
not.
not.
The vaccine and you're wearing 2 masks. Isn't that theater?
No, that's not. Here we go again with the theater. Let's get down to the facts. Okay, the studies that you quote from Crotty and Sete look at in vitro examination of memory immunity, which in their paper they specifically say this does not necessarily pertain to the actual protection. It's in vitro.
And what studies can you point to that show significant reinfection? There are no studies that show significant reinfection.
Let me finish the response to your question, if you please. The other thing is that when you talk about reinfection and you don't keep in the concept of variants, that's an entirely different ballgame. That's a good reason for a mask. In the South African study conducted by J&J, they found that people who were infected with wild type and were exposed to the variant in South Africa, the 351, it was as if they had never been infected before. They had no protection. So when you talk about reinfection, you've got to make sure you're talking about wild type. I agree with you that you very likely would have protection from wild type for at least 6 months if you're infected. But we in our country now have variants that are circulating.
Significant reinfection. What study shows significant reinfection, hospitalization, and death after either natural infection or the vaccine? It doesn't exist. There is no evidence that there are significant reinfections after vaccine. In fact, I don't think we have a hospitalization in the United States after the 2-week period after the second vaccination. We don't have a death in the United States.
You're not hearing what I'm saying about variants. We're talking about wild type versus variants.
And what proof is there that there are significant reinfections with hospitalizations and death from the variants? None in our country. Zero.
Well, because we don't have a prevalent of a variant yet. We're having one. Can I finish? We're having 117 that's becoming more dominant.
Your policy based on conjecture.
No,
it
isn't based on conjecture.
Variants, so you want people to wear a mask for another couple years.
No.
You've been vaccinated and you parade around in 2 masks for show.
No.
You can't get it again. There's virtually 0% chance you're going to get it, and yet you're telling people that have had the vaccine, who have immunity. You're defying everything we know about immunity by telling people to wear a mask who've been vaccinated.
No.
Instead, you should be saying there is no science to say we're going to have a problem from the large number of people being vaccinated. You want to get rid of vaccine hesitancy? Tell them they can quit wearing their mask after they get the vaccine. You want people to get the vaccine? Give them a reward instead of telling them that the nanny state's going to be there for 3 more years and you got to wear a mask forever. People don't want to hear it. There's no science behind it.
Well, let me just state for the record that masks are not theater. Masks are protective. And we
You have
ask
immunity there, theater. If you already have immunity, you're wearing a mask to give comfort to others.
Senator
You're
Paul,
not
you're
wearing a
out of time,
mask
and I
because
would
of any
like Dr.
science.
Fauci
I
to-
totally disagree with you.
Dr. Fauci, if you could respond so that we could understand the difference between the virus itself and the variants and the reason for a mask.
I'm sorry, ma'am, I can't hear you.
If you could respond to the question so that we could all understand the difference between the vaccine in controlling the wild type versus the variants that are out there and the reason for wearing a mask, I'd appreciate it.
Yeah, I mean, yes. First of all, when you have a variant, you have an immunity that you get what's convalescent sera and the same sort of thing. If I vaccinate you or me against the wild type, you get a certain level of antibody that's specific for a particular viral strain. If there's a circulating variant, you don't necessarily have it. You have some spillover immunity to be sure, but you diminish by anywhere from 2 to 8-fold the protection. So the point I'm saying is that there are variants in now circulating. The point that Senator Paul was making was that if you look at wild type only, there is some clear-cut credence to what he's saying. But we are living right now in a situation where we're having a dominance of 117, which was the original UK. We have a very troublesome variant in New York City, a 526. We've got 2 variants in California, a 427, 429, and we have a number of others. So we're not dealing with a static situation of the same virus. That was the only point I'm making.
Okay, thank you very much.
So, in my opinion, if you watch the whole clip, there's no question who won that argument. And especially there at the end when, after Rand Paul's done, but Senator Patty Murray gives Dr. Fauci extra time to make his point. The way he knows, like, the numbers of all the variants off the top of his head. And, I mean, the point he's making is that it's a moving target that the immunity that people have from getting the original virus may not last for as long with these new types. And I think that was made clear in the MSNBC coverage, not so much in the Fox News coverage. And like I said, I've shown you both Fox News and MSNBC. I've shown you the entire interchange there so that you have all the facts to make up your own mind. You can tell me if you agree with me that this is a fair addition to my Fox News Bias playlist, my Fox News Bias and video editing playlist. I put links down in the video description. Also, if you like what I'm doing here, give me a thumbs up. Subscribe to my channel. Also, there are links down in the video description to support my channel financially through PayPal and by becoming a patron on Patreon. Because I think there's a good chance that this video won't even be monetized. Who knows with YouTube? It's kind of a crapshoot every time I talk about something controversial like COVID and masks, I guess. And anyway, I did say this is kind of an old school video, so I'm gonna... Well, first let me check with the live viewers, who I really appreciate. Oh, I've got about 40 to 50 live viewers on a Friday evening when no one thought I would do a video. So I appreciate all of you, and I'm looking at some of your comments. But I am going to ask a couple questions, and I'm going to do it the old school way, like I used to do in my Fox News Bias videos, even though I'm doing it live. So I'm going to live narrate my 2 questions for you, which are, who do you think won the full argument between Senator Rand Paul and Dr. Anthony Fauci? And based on that answer, which network had more biased coverage of the argument between Senator Rand Paul and Dr. Anthony Fauci? Fox News or MSNBC? You like the old school questions? Well, then I guess I should probably finish the video in the old school way, which is by pointing out I've given you my opinion. I've given you all the facts, which means now... Oh. See, I can never get through a video without one clip started wrong, so let me do it again. I've given you the facts, I've given you my opinion, and so now...
I YouTube, you decide.
Thanks for joining me. Thanks to the live viewers. I'll probably cut it off there. I don't know. Maybe I'll have to edit it. But I hope you appreciate this special live stream. And I will be back on Sunday for my Sunday live clip roundup. Sometime Sunday afternoon, evening, California time. Until then, I guess I'll be seeing all of you around the internet.